I'm Dr. Andrew Rodenbarger. I'm a pediatric cardiologist at Riley Children's Hospital and IU Health. I have been in practice since 2019. I knew I wanted to be a doctor for a really long time, and that's at least since high school. And at first I thought I wanted to be in orthopedic medicine. It's probably because I just kept breaking bones and having to see orthopedic specialists for things. But as I went through med school, I realized that orthopedics wasn't for me, and I really enjoyed taking care of kids. My third year of medical school, I was first introduced to pediatric cardiology and realized what a great specialty it was. And that started off with a patient with hypoplastic left heart syndrome. And when I realized that we can do a lot of things to help these kids out, I was hooked. When I see you for the first time, I think it's important to both be able to talk to the patient themselves if they're old enough to talk with me, and whatever family members or friends that have brought them in and really know what's been going on with them. I try to always be able to talk both sides of that, and sometimes that's different language and different ways to explain things. The goal I would have for our visit, for whatever it is that brought you in to see me, would be that we can work together to make sure that we've come up with answers to the questions you have and address any of the concerns that brought you in the first place. My job is great. The pediatric cardiology in general is just filled with slight variations on every single piece of congenital heart disease and whatever it is that each patient brings to the table. Every day I get to learn something new or see a new variation of something that we thought was normal or we thought we already knew things about, and I really love that. On top of that, I do fetal echocardiograms, which is an ultrasound of a baby's heart when the mom is still pregnant. And that allows me to meet a family when they've first found out that there's something wrong with the baby's heart or they're concerned that there may be, and then gives me the opportunity to get to know the family then and walk with them through birth, through surgery, and as the kid grows up and gets to be an adult as well. And I really have always enjoyed that and really getting to know patients as they get older. Outside of the hospital, I really enjoy being able to spend time with my family, which is my wife, my kids, my dog, and even my siblings and my parents as well. We like to travel, we like to be outside and hike and try to see new things. I also really like to run and have competed in a few different races, including the Indy Half Marathon and a few Tough Mudders around the Midwest.